Welcome to another Topic Tuesday. This is Dr. Mike McCall. I want to talk about, we have some other testing we do here, which is, one of those is one of the best ones I know how to do, is this food allergy test. Now, if you've had a food allergy test done with your medical doctor and he sends you to an allergist, a lot of times they may not really find your allergy because you have to look at more than just the one antibody that your body makes. So a lot of chronic problems, meaning things that are delayed. You may have a food sensitivity or food allergy that won't show up when you eat it. You won't get blown up and red, but what happens is maybe, days, maybe hours later, you have other symptoms that seem unrelated. So if you had a chronic problem and you're not quite getting to where you need to do, one of the things you should do is run a food allergy test to get things started. You may be surprised how it can be contributing to your issues. The reason why I do this is a lot of times I have people with chronic musculoskeletal problems, and it doesn't, as we start to investigate, there seems to be more going on in the body than what is warranted. So running one of these tests has helped a lot of patients, especially with any type of arthritis. A food allergy will show up. The next test we have here is, this is a local company, Precision Analytic. They do the Dutch test, and this is a really good test for hormones, but specifically the stress hormones. So a lot of people are now becoming more savvy with the fact that their bodies are under stress, and you want to check where are your stress hormones. If they're low, you have a lot of debilitating symptoms. If they're high, you have a lot of niggling problems. But a lot of times when people do the test, they may test normal. What's great about this is this tests your hormones 4 times a day. And then from there, we can see, is it easy for your body to maintain those levels, or is it very difficult? The other thing that makes this important, especially for women, is a lot of times your body will convert the sex hormones into stress hormones, and you want to find out where the stress is coming from. This is a really good test for people who have brain fog. They seem to strain themselves easy. They start training, and all of a sudden they have a knee problem, that type of thing. This Dutch test is fantastic. I've run one on myself. And then the other test that we're running is Genova. These are organic acid tests, which is a urine test. So this is a urine test. The Dutch is a urine test. And the food allergy is a finger prick that you can just do at home and send it into the labs. These are very inexpensive because you just send them directly to the labs. And a lot of times they'll answer some questions that maybe some of your doctors may be stuck on. And then the next one is an organic acid test, and this is a urine test. And what this does is measures, is there any key nutrients inside your individual cells that need to be looked into, but specifically is the nutrients that you need to help your cells generate energy. It's a really good test, very inexpensive, a very good thing to do, like chronic fatigue or just not recovering. We're also going to eventually do stool tests. That's right, not bar stools, but stool tests. And one of the reasons why I want to run that is a lot of chronic low back pain is usually stemming from an irritated gut, that a lot of times you don't feel it in the gut, but you feel it in the back, but you never know until you look. So I wanted to let you guys know about testing. The reason why I want to do testing is because a lot of times you may have a musculoskeletal problem, but it's not from a musculoskeletal source. So speaking of Source Health Center, Topic Tuesday, we'll see you next week.